first, thank you again for the interview. Despite of being a low frequency population, BRAF mutant advanced colorectal cancer patients are usually associated with uh, poor response to cancer treatment and a poor response to any biological treatment that we can administer to them. This type of population is usually characterized by a really poor survival. So our review focus on the treatment of this type of population. Our review found that many clinical trials and many meta-analyses have just been published in recent years, and we must say that immunotherapy is a game changer here. The Keynote 177 trial found that immunotherapy, specifically speaking of pembrolizumab, improve the progression-free survival of patients with metastatic colorectal cancer in first line. The trial included BRAF mutant colorectal cancer patients. Similarly, the Checkmate 142 included patients with colorectal cancer and BRAF mutation, and the Checkmate 142 reported a high response rate, about around 70%. That's a real important fact. In addition, we also must remember that the benefit found in these two trials is specifically in patients harboring this mismatch repair and MSI high. Patients who do not have this type of mutations, they must be treated with the combination of chemotherapy and bevacizumab. Now, if the chemotherapy combination must be FOLFOXIRI or FOLFOX is unclear right now. We must say that recent publications, recent meta-analysis indicate that there's no benefit in survival between one type of treatment over the another one. So the benefit, I mean the main benefit is on response rate. So if we are using FOLFOXIRI or FOLFOX with the bevacizumab, we must say that the treatment is going to depend on the patient's characteristics. For example, the comorbidities of our patient or the performance status of our patient, and of course, the goal of treatment. Because if response rate is the goal of treatment, we must use the triplet over the duplet here. We have to speak about the Beacon trial too. The Beacon trial is a phase 3 trial and reported that the combination of encorafenib and cetuximab improved progression-free survival in advanced colorectal cancer patients with BRAF mutation. And Beacon trial has very interesting results, and the future type of treatment is going to depend of try to make this combination into the first line of treatment. The Beacon trial is the combination of encorafenib and cetuximab, but since the second line of therapy in advanced colorectal cancer patients with BRAF mutations. It's important to say that we have some survival benefit with the Beacon trial and with immunotherapy in patients with BRAF mutant advanced colorectal cancer. This is something really, really important, but we must say that it's important to try to create a sequence of treatment in this type of patient. As previously I said, this type of population, it has a low response to cancer treatment and a poor survival. the research is the key of knowledge, and it's really important to try to create new knowledge in cancer treatment. Is that's what's really going to help our patients.